Burnout and Caregivers of Patients with Dementia. This module is brought to you by the Urban Service Track in partnership with the Yukon Center on Aging. In this module, we will cover various learning objectives. We will define dementia and how to identify and address caregiver burnout. We will end this module with a reflective pre- and post-assessment. By the end of this module, students will be able to define dementia and list the 4 most common types of dementia, describe the societal impact of dementia, identify 3 challenges for caregivers of family members with dementia, define caregiver burnout and identify 3 symptoms of caregiver burnout, and identify tools and resources to share with caregivers at risk of demonstrating burnout. First, let's define dementia. Dementia is a syndrome of progressive cognitive decline that interferes with everyday activities. There are various types of dementia. The most common types include Alzheimer dementia, which is the most common type of dementia caused by deposition of proteins that damage brain cells, vascular dementia, which is caused by impaired blood flow to the brain, often seen after a stroke or a series of strokes, mixed dementia, where changes representing more than one type of dementia occur simultaneously in the brain, usually Alzheimer dementia and vascular dementia, Lewy body dementia, where proteins called Lewy bodies build up in areas of the brain that regulate behavior, cognition, and movement, and frontotemporal dementia, which primarily affects the frontal lobe of the brain, resulting in personality changes such as socially inappropriate behavior and lack of inhibition. Regarding dementia in our population, 1 in 1,400 adults between the ages of 40 and 64 will have dementia. In those between the ages of 65 to 69, 1 in 100 will be affected. Between the ages of 70 to 79, 1 in 25 will be affected, and in those 80 years or older, 1 in 6 will have dementia. As was stated before, Alzheimer dementia is the most common cause of dementia. It is a neurodegenerative disorder that primarily affects older adults. The most essential and often earliest clinical manifestation of Alzheimer dementia is short-term memory impairment. As you can see on the slide, here is a normal brain on the left in comparison to a brain of an Alzheimer patient showing diffuse cortical atrophy. Protein deposition leads to death of neurons, which causes atrophy. The Silver Tsunami is a phenomenon driven partially by advances in medicine that are helping people live longer, but also by the fact that baby boomers are reaching old age. It is estimated that by 2050, senior citizens, that is people over the age of 65, will represent more than 20% of the population, up from 15% today. This represents about 40 million additional individuals over the age of 65 that will need medical care. As our population ages, we must take a close look at the source and funding of their care. Understanding the crucial role of caregiving. Caregiving is defined as providing a wide array of help to an individual with a chronic, disabling, or serious health condition. Assistance can take many forms, including personal care and assistance with daily activities such as bathing, dressing, paying bills, handling insurance claims, preparing meals, or providing transportation. Carrying out medical or nursing tasks such as complex medication management, tube feedings, or wound care. Locating, arranging, and coordinating services and support. Hiring and supervising direct care workers such as home care aides. Serving as advocate for the care recipient during medical appointments or hospitalizations, communicating with health and social service providers, and implementing care plans. Intense caregiving means providing 21 or more hours of care per week. A family caregiver, broadly defined, refers to any relative, partner, friend, or neighbor who has a significant personal relationship with and who provides a broad range of assistance for an older person or an adult with a chronic, disabling, or serious health condition. Family members are often the main source of help when it comes to caregiving. 2 out of 3 caregivers are spouses or adult children of older adults. According to the National Study of Caregiving, each helper spends an average of 75 hours a month on caregiving, about the same as a half-time job. As you can see by the graph on the right, the vast majority of caregivers are unpaid. If we could put a dollar value on caregiving, it would total up to about $470 billion in annual costs each year. That's nearly as much as Walmart's annual sales of $477 billion per year. This number also exceeds total annual Medicaid expenditures, as well as combined annual sales for Apple, IBM, Hewlett-Packard, and Microsoft. Caregiving by a family member, however, can have some benefits. The graph on the right shows that most caregivers found that there were positive aspects to caregiving. These include a potential decrease in the financial burden of having a paid caregiver, the satisfaction of knowing that the recipient is well cared for, as well as an increased sense of closeness to the person being cared for. But there are some risk factors or challenges that a family member may face when taking on the role of a caregiver. Often, the focus of care leaves the caregiver without necessary self-care, such as being able to have a healthy lifestyle or having time for their own medical care, spiritual care, and emotional support. Some risk factors for adverse outcomes due to family caregiving can include socioeconomic background, the intensity or type of caregiving, and the amount of social and professional support that is otherwise available to the caregiver. Just a few stats on family caregiving. 68% of family caregivers use their own money to provide care to their relative. 39% of them felt financially strained. As it relates to time commitment, caregivers usually spend an average of 18 hours per week providing care to a family member. 60% of family caregivers have had to care for their adult relative while being employed full or part-time. About 22% of them provided 21 hours or more of family care per week while working on a job. 55% of caregivers report feeling overwhelmed by the amount of care needed for a family member. Often caregivers are sandwiched between trying to care for children as well as older family members. 1 in 4 workers aged 25 or older are family caregivers. 72% of caregivers aged 40 and up stated that flexibility at their job would help improve their work-life balance while caregiving. As healthcare providers, it is imperative that we know how to identify and address caregiver burnout. Caregiver burnout is defined as a state of physical, emotional, and mental exhaustion experienced by a person as a direct result of their role as a caregiver. Symptoms of caregiver burnout can often mimic symptoms of depression. These include withdrawal from friends, family, and other loved ones, loss of interest in activities previously enjoyed, feeling blue, irritable, hopeless, and helpless, changes in appetite, weight, or both, changes in sleep patterns, getting sick more often, and feelings of wanting to hurt themselves or the person for whom they are caring. Caregivers have often been described as hidden patients, which is why it is important that they undergo vigilant, periodic, and ongoing caregiver assessment. We as providers should assist with identification of caregiver stress and have ongoing discussions about coping mechanisms for caregivers. Systematic quantification of the level of caregiver burnout can be done through the use of validated questionnaires. This slide shows a sample questionnaire called the Zaret Burden Interview, which is comprised of a series of questions to ask a caregiver to assess their level of burnout. Here are a few questions that you can ask to assess caregiver burnout during an office interview. Do you feel that you are currently under a lot of stress? What aspects of your day are the most stressful? Have you been feeling down or blue lately? Have you been feeling more anxious and irritable lately? Do your friends and family visit often? In addition to asking general questions, here are a few ways that you can actively address caregiver burnout. Respite care. Providers should give caregivers permission to ask for help regarding respite care and assist them in finding sources for assistance. Behavioral issues. The caregiver's skills in managing behavioral issues should be explored in more detail if the screening questions indicate problems in this area. Strategies for stress relief. If the caregiver has trouble listing his or her strategies for stress relief and coping, this is an area for further questioning. Elder abuse. After the caregiver's behavioral management and coping strategies are assessed, it is imperative that you consider the possibility of elder abuse. And patient education. The caregiver's knowledge about the dementia illness and available resources should be further explored and additional information provided when needed. This next slide shows a list of resources for providers as well as support services for caregivers of patients with dementia. At UConn, we have a comprehensive memory disorder center that includes education and support for caregivers. Thank you for reviewing this module. We hope that you've learned a lot. Please take a few minutes to complete the learner evaluation using the link below. The evaluation is a retrospective pre-post survey which asks you to rate your knowledge about addressing caregiver burnout both before you started this module and after completion of the module. Here is a list of references used to gather information for this module. Special thanks to Dr. Karina Berg and the UConn Center on Aging, Petra Clark Duffner and the Urban Service Track, and Dr. Adam Perrin for narration of this module.